this our second panel of the day, where we're going to talk about alcohol. I'm going to call to the stage our friends, the criminal justice of the public prosecutor's office of the state of São Paulo, master and a doctor from the University of São Paulo, and also member of Porta Beta Foundation, specialized in the abuse of substances by the Humphrey program in the United States. He was the coordinator on the policy of drugs of the state of São Paulo and member of the League of Custodians of Alcoholic Animal Anonymous in Brazil. So, Dr. Mário Sérgio Sobrinho, welcome to Freemind. You're very welcome to our Congress. May you come to many others. First of all, good morning, everyone. It's a great joy to be here in the 10th at the 10th Freemind, and greater joy to be able to contribute to this Congress regarding a panel that is going to talk about alcohol and adolescence, and having the satisfaction of listening and also absorbing knowledge that our panelists, four panelists here that are very capable, that will treat with you, address with you this morning. My thank you to Paolo Martelli, the Freemind staff, which make it happen. Continuous work, hard work, and very intensive, so that everyone are well taken care of and serviced, catered to, not only technically through the lectures, but also in this wonderful environment we're in. So we are convinced that drug policies cannot cannot advance without treatment, prevention, and social reinsertion topics accompanying it in its path. We are going to focus a lot on prevention in this panel, and you will have great moments of interaction here listening to our lecturers. I'm going to introduce each one of them and ask that you kindly take your seats. So, Dr. Juliana Valente. Juliana Valente is an assistant professor of the Department of Preventive Medicine of Unifesp. She's a psychologist, master in health sciences, and doctor in collective health. She's a researcher in the areas of prevention against the use of alcohol and other drugs, with focus in parental skills and assessment of preventive programs. Thank you so much, Dr. Juliana. Dr. Zilla Chances. Dr. Zilla is the chief of department of preventive medicine of Unifesp and associate professor in epidemiology. She's the lead editor of Journal of Prevention, Springer Nature, an international name in the search about alcohol and drugs used by among young people. She has written more than 200 scientific articles, advisor to the WHO, OPAS, and the UNPD. And she also is the leader of the group on the prevention against the use of drugs, Unifesp. And now Dr. Laura Curi, coordinator of the project, Alcohol ICT, Bachelor, a graduate from the university degree, a master and doctors in social history by PUC São Paulo, certified by the University Johns Hopkins on the use and control of tobacco, with experience in the areas of international relations, history, communication, DCNT, and sustainability. Welcome, Laura. And to all complement this team of professors, specialists, experts, we have Dr. Angélica Maria Claro Galvez. She's the manager of the advocacy Movende International, a psychologist with specialization in health psychology, and she's taking a doctorate degree in public health by the National University of Colombia and has been in this position that I mentioned in Movendi International since 2022. We have a panel that has been made for all of you. I will ask people, the staff, to get ready for putting on the slides. We are going to listen to our lectures. So, Juliana, please, if you could, the floor is yours for 20 minutes to talk to you. Thank you. Hello. Good morning, everyone. Good morning, everyone. It's a pleasure to be here with you, talking about such important topic, which is the consumption of alcohol by teenagers, and it's a pleasure to be here with these professors, experts, and researchers in the area. And I think it's still not at the beginning, but let's go to the beginning of the presentation, please. If you could put it on the first slide. Okay. So, to begin talking to you about this topic of the consumption of alcohol made by teenagers, it's important to provide some context scenario on the consumption of drugs in general among teenagers. So for that, I brought you data of the most recent national research of schoolers uh, carried out in 2019, and it gives us some information about the prevalence of the beginning of consumption of drugs among teenagers. So, what is relevant to think about in this context? How much alcohol stands out in terms of prevalence when compared to other drugs. So what this research showed us that among 13 and 70-year-old students, 63% have said that they tried alcohol sometime in their lives. So over more than half of teenagers from 13 to 17 reported having some experience with alcohol consumption. And this prevalence is much greater than as you can see, than the prevalence of other drugs such as electronic cigarettes, conventional cigarettes, which have grown as the other panel showed, but the prevalence is still much lower than the consumption of alcohol and among adolescents. And this talks about the relevance of we being having much more focus and paying much more attention on this topic. Although marijuana consumption, illegal drugs is worrying also. Alcohol is the predominant drug, so it's the one we have to look closely to more intensively. It's going to be present in the houses, services, schools. So that's where we have to pay attention to the most. So based on that, I brought data about the differences also between boys and girls, the difference of consumption between boys and girls. So as I said before, 63% of students mentioned that they have tried alcohol at least once in life. And when we look at the difference between boys and girls, we see that the girls are trying alcohol much more than the boys. So 67% nearly of the girls said that they have tried alcohol when compared to boys, around 60%. So this is data that most recently have really called our attention of how much there has been an inversion. There is a trend now, a more recent trend, that the teenage girls are consuming more alcohol when compared to the boy teenagers. And it's beginning increasingly early in their lives. So when we ask the students how many had tried first time before they were 14, 34% of all of them said that before 14. And when we look the difference between girls and boys, girls are have been begin drinking earlier than the boys. Nearly 37% of them said they tried it for the first time before 14 when compared to the boys. So this data really stands out to us. So we have to look more carefully at the girl teenagers when we talk about alcohol consumption. This trend has remained in a more recent survey, Lenard survey, which collected data specifically about alcohol and other drugs in Brazilian population in general. This is from 2023. And this data is always standing out, the fact that girls use more alcohol than boys. So when we look at consumption in life, in the year, and the last month, in all situations, so different metrics, different ways of evaluating alcohol consumption, the three different metrics showed consistently that girls are consuming more than boys. This is a big concern, certain aspect, considering the greater vulnerability, physiologically speaking, and other issues of the girls in comparison to the boys. So that's something we have to really pay attention to. On the other hand, the 2023 Linard research also provided more positive data also. It showed a decrease in the consumption of alcohol by teenagers. So I show you, I have these figures here that we see that from 2006 to 2023, we see girls and boys and adolescents in general, they have decreased consumption throughout the years. This is a trend that we corroborate, and international studies also corroborate, have evidence also this decrease in consumption of alcohol among teenagers, and we have to see and pay attention if other studies also corroborate this trend. This is a positive trend for sure, and because there have been some changes in adolescent behaviors. And why is it seen as something positive? Because in fact, the interaction between alcohol consumption and teenagehood is very harmful. One of the reasons why it is harmful is regarding brain development in adolescence. The teenage brain is still under development. So although many times they place themselves as individuals with lots of opinions, attitudes, wanting to manage their own lives, we have to always remind ourselves that from the neural perspective, it's still a human being under development. So there are areas of the brain that are still being developed, areas responsible for taking decisions, controlling impulses like the prefrontal cortex and some other areas responsible for that has still not fully developed. And there are also areas in the brain responsible for pleasure, sensations, seeking for new things that is extremely activated during this phase of the brain, such as the rewarding system and dopaminergic areas of the brain. So it's a time, the life of a teenager, that is very crucial if they get involved with alcohol consumption. So we have to think of always making the first try, the first experience of using alcohol, make it be later on in life as much as possible. So we have to always seek that. So the later you try alcohol, or these teenagers try alcohol, the lower the risks involved in this process. So there are several studies and a great amount of evidence that also speak in favor of that, of making the first use be later in teenage years. So two finding here showing that nearly half the chances exist for those who start beginning before actually showing some risk consumption in their teenage years, the greater the chances of becoming drunk. And when we talk about studies that accompany people to their adult years. There's a risk of those that start drinking earlier, before 14, that there's a risk of abusing of alcohol 4 times more, or 10 times more of becoming dependent of alcohol in life. So I'm bringing these two images to you that talk about this. So a study that monitored adolescents since their first years as teenagers until they became adult, and the chart shows the earlier you start drinking, the greater the chances of having a problematic use or even becoming dependent. So all this to justify, to corroborate the need to think of strategies, prevention strategies regarding this consumption. We like to highlight one of the guidelines of the WHO for the prevention against the use of drugs, and it was created to synthesize the studies around the world available, to translate it in a more clear and summarized way with very clear instructions of what should and what should not do if we want, in fact, to have greater chances of reach our goals of preventing this type of use.
These guidelines have two editions, and then I will address what they say regarding prevention in this age group, which is first adolescence, when young people truly start to get involved with the use of alcohol and other drugs. So the guidelines indicate some interventions that can be made with that goal. I'll talk about two of them because my colleagues will address the other ones. I will talk about the programs at the individual level, interventions at the individual level, and interventions at the family level. So when we talk about interventions at the level of the individual, the ones that may be more successful and more effective are the interventions that address personal and social skills, which we call life skills. So these programs, they are prevention programs that seek to strengthen protection factors within the individual and decrease risk factors. So we work with personal skills, decision making, resistance skills, and we try to change risk perceptions, increase the risk perception regarding use of substances, change wrong assumptions that exist regarding the topic. And it's interesting that it does not, they talk about specific characteristics of prevention programs that are related to success and some characteristics that are related to evidence that they are not effective, programs that did not work or even resulted in the opposite effect. So positive characteristics, having programs based on life skills, interactive methods, sessions that are structured, so programs that are continuous instead of isolated actions, for example, 10 to 15 sessions that can be reinforced throughout time and also held by people who are well trained to do that activity. On the other hand, programs and interventions that are not successful, that achieve negative results, programs that do not use interactive methods, that are based only on lectures, there's no evidence that they will work to prevent consumption of alcohol and other drugs. And there are evidence that show that can even cause the opposite effect. Programs based only disseminating information. It's evident in the literature that it does not work. So it's important to convey information about negative consequences, but within a bigger context, within a program that addresses other skills, not only this one. Not this one alone does not work. And address issues related to moral and ethics and values don't work either. So, in working with the testimony of former users, there are studies that work that are not beneficial. I'll try to speed up. There's a lot to talk about. Now, talking about what we can do in terms of parents, the family. So programs that address parents, they also address protection and risk factors. So both for individuals and parents, the only focus is not only drugs, talking about drugs. We also address promoting protection factors and decrease risk factors. And in the case of parents, they are the parenting skills. So in this case of parents, that's what we must do. Skills that will foster family bonding. Skills that may help them to become more present in the lives of their children, monitor their behavior, establish dialogue, knowing how to handle conflict. These are the skills that must be worked on and through structured activities. On the other hand, the negative programs are, as I said previously, holding only lectures or only conveying information. These two are not associated with positive results. What else, apart from programs, parents can do for their children? Or educators, healthcare professionals that are dealing with the parents who are worried about their children use of drugs. So there are a series of evidence and studies saying what can we do to help teenagers to not get early involved with alcohol. I'll highlight 4 factors regarding risk and protection. One of them is parental consumption, excessive parental consumption, episodes of being drunk, of drunkenness. So this is a risk factor for teenage consumption. So we must always inform parents so that they pay attention and know about that. Another element, which is a protection factor. Parents establishing rules regarding the non-use of alcohol at home. Many studies show that when they make it clear for their children that they do not agree with alcohol consumption among teenagers, this is a protection factor. In addition, the issue of parents offering alcohol to their children, there are some people who think that teaching their child to drink at home, they can somehow protect them from having a negative relationship or having abusive use. Studies show that's not a path, that's a myth. The truth is that parents offering alcohol makes them more available, more prone to develop abusive use of alcohol in the future. And finally, another element that's protective, it's monitoring. To monitor systematically. Parents that are close to their children, they know where they are, with whom they are walking, who are their friends, and those who are paying attention to them, that's a protection factor against alcohol consumption. And also parents who can offer emotional support, who are available for dialogue. Studies show that the simple fact of having meals together as a family that makes teenager be more protected. So generally speaking, that's what I wanted to say. There's a series of evidence and studies and practical examples that show what's the path we must take to have greater chance of attaining our goal of delaying the first use of alcohol by teenagers so that we can reduce damage, harm in the future, reduce problematic consumption, the chance of developing dependency, and we must understand it and find strategies to put this in practice. And therefore, now I'll give the floor to my colleagues that will follow me. So thank you, Juliana, for your intervention. She highlighted the issue of communication among children and parents throughout their lives. And it's important that family monitoring, as Dr. Lotufo says, that monitoring is essential. We will continue our panel hearing Zila Sanchez, who will talk about community prevention against the use of alcohol among adolescents. You have 20 minutes. Welcome. Good morning. I will wait for my presentation to show up. I will do the following. Juliana mentioned various scientific evidence. She discussed what science already brings and says, and I'll try to bring this to practice. So I will illustrate what was discussed and effectively talk about a project, a program that we are developing in small towns in the countryside of São Paulo, funded by FAPESP. And what did we do? What are we doing to be able to get to the field and implement programs at the community level in all municipalities? So it's not isolated, only school or only family. It's everything, including the community as a whole. So let's start. Why did we choose to offer a multi-component intervention that's community-based? We know that isolated interventions, when we have only one group, one sector, these interventions are not as effective when we compare with multi-dimension interventions. So in general, the proposal of community interventions is a proposal that will look at different contexts and seek to create healthy environments for teens. The idea is not to change only individuals, the behavior of parents or teens, but especially change the environment so that the community starts to understand the true harmful effect of alcohol. So the innovation is the following. It's an innovation because we conduct various simultaneous interventions based on scientific evidence, based on an intervention for teens at schools, for parents implemented in schools as well, and through police officers, all law enforcement agencies, the control of the sale of alcohol to minors, which is the best intervention, is the most effective one when we decrease access. When we decrease access, we decrease consumption. So it's extremely intelligent and cost-effective to work together with law enforcement to repress the sale of alcohol to minors. These actions are developed in partnership with all stakeholders. Who are they? The community. And since management groups, city hall managers, the Secretary of Safety and Health, but also stakeholders, especially teenagers, parents, owners of bars and establishments, restaurants, they must participate in co-creating these interventions. These city interventions, they must be adapted to the local needs. So we can't necessarily replicate 100% an intervention that was conceived for a small town. We cannot take everything to a big city in Minas Gerais, for instance. We have to discuss the different levels and the different capacities of each municipality. These interventions, they act on multiple protection and risk factors. We're not looking only at the family, how parents monitor. We're looking even at how the environment and the community culture function. For instance, people who work selling cachaça. So these communities we need interventions in these communities that address that. We need to understand what happens in these municipalities. To do so, we must work closely with City Hall. We also must think about different implementation strategies. One strategy may work very well in the countryside of São Paulo, but it will not work well in the countryside of Ceará state, maybe because schools work in different time or because the city has a public safety secretariat and the other city does not have. So we must consider and work based on all these different factors and work with all stakeholders. So what as Prev Action, which is this program developed by the Previna group at Unifesp. It has three main components. One is implemented in schools, all schools of the city. One family component for parents and those who are responsible for children, all municipality schools, and a community access focusing on the general population with full support of public safety department to control the sale of alcohol to minors. We said it's a project that includes science implementation because we will see what works to whom and under which circumstances.
That is, we're trying to develop a model based on scientific evidence, which is Juliana mentioned already, but with the capability and with the appearance of implementation that adapts to the local place. So many times what has been designed to be implemented in the city of São Paulo cannot be implemented in a countryside town and vice versa. So within the implementation scope, what we do and how we do it, and what are the cities that are participating? So we have Cordeiro Álvares town, Salesópolis town, which we call intervention towns, who are the ones that receive the programs. And we have Irisimápolis and Biritiba towns, very small towns in the countryside of São Paulo. They are control cities, which means that right now they're not having this intervention, but they are being monitored to see if their teenagers, how they use it, how is their pattern of alcohol use, even without intervention. So we evaluate the group that gets the intervention and see if the teenagers change their pattern of use. And then we look at the teenagers of the control cities that do not receive intervention and how they work without intervention. This is because there's another important message here, not always something that was planned based on evidence that we think will actually work. Sometimes it doesn't. So that is why we have to evaluate and monitor the effect on teenagers to see if it in fact consumption was reduced, or if now consumption is starting later in their lives. Postergating their first use. So we diagnosed the situation of these towns to understand what teenagers are consuming there with 4,000 students, several focal groups with teenagers, interviews with school administrators, parents, to understand what happens. To give you an overview of this intervention design, we have consumption of alcohol of 52%, a bit lower than pains, but a bit higher than pens regarding e-cigarettes. But this has to do with the fact that data was collected last year. So they're more recent data than Pensy. Marijuana, 8%, inhaler 7%, and hallucinatory substances 2%. Regarding the perspective of the environment, all towns, specifically the ones participating, have alcoholic, intense alcoholic environments. So all those country parties, fairs with alcohol, all type of environments, open environments that incentivize the use of alcohol, they have there. So, and these teenagers, they always go to alcohol establishments, alcohol warehouses, and they consume spirit mixed with non-alcohol drinks, and they consume it around to 700 ml. So through the diagnosis of the situation, we saw that teenagers don't have many things to do there, other options to do there at the cities. They are encouraged by their own parents to consume, and group pressure is huge. They don't have a space to use on the squares. There's no inspection. Parents encourage it, and friends do it as something unique, as the only entertainment activity they have. So the research is a intervention research, as we call it. We start by understanding their reality with all the administrators. So here we have some pictures that you can actually see something, an image, and then we discuss the diagnosis with the administrators. So several administrators, public administrators from the city hall, and we have to accept it because it's impossible to get into this without the support of the city halls, the town halls. We need to get authorizations from state schools, São Paulo state schools. We have several hurdles, but we have overcome them gradually. So all this entire discussion of what to do and how to do it starts with the science of prevention in the discussion of possibilities of implementation with these public administrators. So we know what has to be done and how to do it, and we'll discuss with these administrators what needs to be done and what fits the specific town. So everything is discussed based on science. Science and implementation work together. Though there is the need to take ownership of this science and put it into practice to the end user to make a difference as scientists, so we can actually contribute to society. So in the schools, there was implementation of the program Tamo Junto. They have just ended this implementation, 12 weekly lectures of life skills, so information about drugs, but also the program has several classes about independence, resistance to consumption, decision making. These classes are given by their teachers, and we had seventh, eighth, and ninth grade students participating. We implemented several implementation obstacles that are we're trying to revoke these obstacles, so the classes take much longer than planned because the teenagers get involved. They want to have the role plays and all the dynamics. They want to do all these role dynamics, role plays. So it's taking longer than we expected or planned at the beginning. They need to include it as a subject because right now it's not part of this formal curriculum. So easy, just small obstacles like the teacher's notebook. The teacher will look at the teacher's manual. The manual will read the manual and tell us, this is not a teaching material. It's not effective. And then the teacher will tell us, look, it should be like this to be effective as a teaching material. So bringing all this into practice to the end participants of our program and all demands of education, and we have to balance all the needs. So we have also the need of the Secretariat of Education, the number of school class of Portuguese classes and maths classes that need to be given. We have to balance all this. And infrastructure issues. How can we adapt this activity, this class, into a space that we cannot remove the tables from there? How can I create a circle there? So maybe we can try use the arts room or the court yard of the school. So we talk and discuss all this with the teachers. Now we're in the phase of trying to solve this. We had these initiatives of to make it easier for the teacher, sending videos through WhatsApp with tips of how to implement that class. So he gets that video, watch a 2-3 minute video on WhatsApp, and understands in a very more practical way what he has to do or not in that specific classes. So strategies that have been designed to end and to tackle these difficulties. Here we have the teenagers participating in the program, and we also have the family axis, which is to adapt, a need to adapt the Familia Fortes program, which is gigantic, several classes, several sessions. It was applied in class, long activities, a high cost of implementation, and we thought of reducing it, this program, and with it, uh, combine it to other programs such as Parent Workshop in Tamo Junto and an European program within a specific program called Orimbro. So based on an international and another national program, we developed CORA, Communication, Guidance, Rules, and Monitoring. So we get these other programs that work and combine them and take the content to the parents in a simpler and faster way than Familia Fortes, which is a very long program. Here is the manual of implementation of CORA. It is composed of 3 meetings. All meetings are life skills meetings where the parents will, in fact, learn in practice how to deal with the difficulties of adolescents, how to say no, establishing limits, supervising their kids. So it's a more practical approach of strategies of how to develop their parent skills. So there's also a process of co-creation with the parents. So the parents, in fact, sat down and discussed with us, took the manuals and told us what would work and would not work, gave us several interesting ideas. The faster, the lesser meetings, it's better. So they gave us several ideas so that we can improve what was already a public policy program of the state government of São Paulo. It's difficult to get to have the implementers at the end at the schools due to the lack of teachers and school coordinators. So this is a community access. In this access, the main focus is environmental prevention, where we try to change the environment to change behavior. And in this access, we inspect the point of sales, train the sellers so they actually understand why they should not sell to teenagers and children, and the training of leading teenagers. So such as scouts, Girl Scouts, Boy Scouts, something like that, that they can pass on to their parents the knowledge about they learn through the training about alcohol. So we have we're supported by the city's public safety secretariat, children's services, boards, the police, and so that they are all our partners, so we can effectively reduce the selling of alcohol to these children under 18. But we have several obstacles. In case we have public administrators here, it's important that you think, what are the strategies to create an actual flow to control the sale of alcohol and avoid the sale of alcohol for people under 18. Nothing is very clear in this sense in the laws of Brazil today. And to conclude, my final slide, what do we want to reach with this intervention? A model of intervention that can be incorporated up as a town and city public policy. It has to come from the public administration of the town and managed by these city secretariats. We are transferring technology, social technology, to other cities and towns of the state of São Paulo, develop strategies that are sustainable so that dissemination is continued, and the main focus and the innovation are all the strategies of controlling the selling of alcohol to people under 18. And now that we're in the process of seeking data that we call follow-up, which is post-test, to understand and compare towns and cities to see if there were any changes, we expect that we're in an active phase of collecting data and identifying if there was in fact reduction in consumption. This is our staff, all the researchers of Previna, all in uniforms to make the collection at the schools. And here we have a QR code if you want more information on the project. Thank you.
Thank you very much. You're showing to us something, a recent expression regarding the alcoholic environment and how very often we contribute to that. So we must have critical thinking that school and community and the family are at the basis of this prevention program. Now, I'll ask Angelica Galvez to come to the stage and talk to us about the strategies, the global strategies to regulate alcohol and its availability. Thank you, Angelica. Thank you very much. Good morning. I'm from Colombia. This is my first time in Brazil, so I did not have yet the opportunity to learn Portuguese. Uh, I'm glad that most of you understand Spanish. This does not happen with me. I don't understand Portuguese very well, but I will share with you the concept that is, well, we work with it a lot where I work, which is very well connected with what Sila has just described and what Mario has said about what we understand by an alcoholic environment. I believe that you are all here very well behaved in this panel, listening, because like me, like Freemind and I, you want to protect youth from alcohol. So if you wish to protect them, we must start and we must remember what's the world they are growing in and ourselves, because we are in the same world. And it is a world where we have an expression that's from the point of view of children. We live in a world that has alcohol issues, alcohol problems with alcohol. Why? Because it is used excessively and is available physically. We mentioned that in the campaigns. If you're going to drive, do not drink, or if you're going to drink, do not drive. But when you are driving, you are receiving advertising, alcohol advertising all the time. I don't know if that happens here in Brazil, but when you go to a gas station, you see that they are selling alcohol in the convenience stores. So it's alcohol is largely available in this world. But regarding the social issue, it's very important to see how alcohol became the owner of socialization. It seems that our fun and our ability to share time with friends belongs to alcohol. We as human beings, we're not born consuming alcohol. We used to have fun in our childhood without consuming alcohol. At some point in our lives, an industry very conveniently told us that alcohol was equal to fun. Even people who work with prevention, they say you can also have fun without alcohol. But that's obvious. We can always have fun without alcohol. Alcohol is not the owner of fun. But since there is a high availability of alcohol everywhere, at the health ministry, I heard someone saying that it's because here in Spain we do not have library, and the only way to have fun is going out and hanging out. And I was thinking, wow, that's great that you need libraries, but if young people like to dance and like to share with their friends, why do they need to go to the library? They should go out to dance and hang out and go to a concert, to carnival, so that, but in these parties, they should not have such a strict bond with alcohol. Alcohol should not be the only way to have fun in a concert or a party. And the CEO of Heineken is at this moment using a strategy. He has reached many countries, showing that he's very committed, saying that beer is essential for social connection and mental health. So what they're saying, this active campaign of Heineken is what is saying at that moment. But alcohol is available at the economic level. Yes, alcoholic beverages are very cheap. And I think that Laura can confirm that this happens as here in Brazil. Alcohol is cheap, and so cheap that the alcohol industry says that its products are cheap and that they are very available psychologically. A teenager might not ever have tried alcohol, that he has never consumed alcohol, but that he has expectations regarding how he will feel when he tastes it, when he experiments alcohol. And there are expectations and beliefs regarding alcohol, even without trying it. And these expectations and beliefs are formed when the child has only 8 years old, when they are very young. We talk about teenagers, but this is not only related to teenagers. We must pay attention to what goes on with children. That excessive physical availability, psychological availability, and social availability makes the rule of the alcohol be created. The rule of the alcohol is a social rule in which it seems that what's expected, what's normal, is alcohol consumption. And then when we talk about parents or teachers and we say, my Paulo, we're going to show the development of the brain, and I do not want my child to consume alcohol now. But I expect that to happen at some point in his life. I want them to do that at some point in their lives. Mothers and fathers are nearly condemning their children, saying that they will consume alcohol for sure. So it's not correct. So it's not uncommon that fathers and mothers offer alcohol for the first time. So there's no awareness regarding the damage caused by alcohol. So we who do not consume alcohol, we feel that we are weird because I have to explain, I have to justify why I do not consume alcohol. No, I'm pregnant. No, I need to drive. I need to have a valid excuse to say why I'm not consuming alcohol so that I'm not considered the weird one. And there are issues related to psychology. Alcohol consumption is an individual decision, and I have been asking some informal questions. This is not a scientific research, but I have asked people who consume alcohol if they recall the moment when they decided to consume alcohol. So, do you recall the moment when you decided, I'm going to start consuming alcohol? The truth is that I have never found anyone who does recall that. But when I asked people who do not consume or stopped consuming, they recall the moment when they decided to no longer drink, and they recall the reason why. And why that? Because the default behavior is to consume alcohol, and the decision you make is to not consume alcohol. So we're talking about an environment in which the alcohol is the norm, and we are living that currently. And they want to make us believe that alcohol consumption is normal. It doesn't mean that everyone must do the same thing. Before, I used to give lectures. I used to give lectures to parents and teachers. And we had statistics that were very similar to those presented by Juliana. And told the parents that 30% of students in the country consumed alcohol. And the reaction was, wow, that's too bad. It's just that teenagers, it's very difficult for them. 30% consumed alcohol in the last year. And when I start to move and I start working in Movendi, I said 70% of alcohol are free from alcohol throughout the last year. And you know what's their reaction? They ask, what research is that? They do not believe in in that data. And it's exactly the information. When I tell them 30% consumed, they think, wow, that's terrible. When I say that 70% did not consume, they don't believe me. They think it's a lie, because the rule of alcohol makes us believe that everybody is consuming and that everyone who consume wants to consume always. And there are people who consume alcohol but do not want to do that necessarily for different reasons. Now, if you're going to see what is truly going on, I'm sorry here. I want to say that when I do not consume alcohol, it's half of people of the planet, because we are millions of people. Even in Brazil, we have thousands of people who do not consume alcohol. And that's not a new thing. But I must say that the Gen Z is showing that there are other possibilities. This is a study in Latin America that's not related to alcohol. I found it by chance. And it shows how men in Latin America, in this research, one of the questions was related to alcohol. And they asked men how important was alcohol to have fun. And actually, the minority said yes. During the Euro Cup, which was a Sunday, people said, I wanted to be not, I want to be okay on Monday, so I will not drink today. So so this is the reality of what's happening today. This is a Chilean experience. I don't know such an experience. We don't have such an experience here. And there's a channel and a strong activity regarding parties, events, carnival in Chile, free of alcohol, alcohol free. So Gen Z has repeatedly reported in Spain and in other places how they are less interested in alcohol. Famous people who talk about that differently than in the past, because they stopped consuming alcohol, not because they have not because they have a dependency and they stopped to have alcohol. But the discourse we are hearing today from famous people is different. They're talking about the benefits of living alcohol free, how well they are in their lives with their partners. And among influencers is and famous people, that change is important. Young people are no longer interested in being drunk when they socialize or use drugs in general. That's an experience of young people in Latin America. They're not only less interested in the use of alcohol, and they are saying to the industry, stop focusing on us. Young people are demanding a change. Of course, the industry is not liking that. That's a trend for every one of us here because the industry is openly concerned.
So we cross our arms and say, "Oh, we are very wrong," because what happens is that they will say, "We're thinking of strategies to capture the interest of the Z generation." What seems positive has have an effect in the industry to reach a younger consumer. They need innovation, they say. So we cannot, remain quiet. This norm of alcohol that I mentioned in the beginning was not created alone. It has an industry of alcohol that supports. We have groups that are, fake groups, and we need to identify it. I know excellent researchers that have profound knowledge about prevention and action based on evidence, but they have worked for the alcohol industries because they were hired by these fake groups that are composed by the alcohol industry, such as FISAC, Mexico CISA, and this industry, in fact, is working with a cooperative complex that includes other actors that is closely related to the tobacco industry and other type of substances. In this last part of my presentation, I'd like to talk about what the alcohol industry is not saying versus what it is saying, so we can compare both pieces of information and understand why teenagers need to be protected from the alcohol industry activities. It's not saying that it's psychoactive, that it can provoke cancer, and so on. In Chile, recently, regulation includes these warnings, except for the cancer warning, because the industry was able to fight against that. In Europe, there's a law with labels saying that alcohol can cause cancer. It has been approved and will be applied in 2026 by the advocacy of the industry of alcohol. The industry always does everything they can, so we never have information on the fact that the products are toxic and can cause cancer. 76% of the sales, according to a study in low income countries, come from the consumption. And more specifically, consumption, the excessive consumption, and the episodic consumption, as defined by WHO in Germany, 40% of the income of this industry comes from this type of consumption. This data needs to be evaluated. The alcohol industry invests in publicity very strongly. There are 7 alcohol industries internationally that invest over $15 billion per year. It seems that alcohol is a correct way, according to these companies, of having fun, relaxing. The alcohol industry, according to an Australian study, a recent Australian study, mentioned not only carried out not only and assessed not only advertisement posts, but also one of the most things that are difficult and that this Australian study showed is that when people searched on the internet to stop of help to consume less alcohol, these people were identified by the alcohol industry, and then they would get more hits of advertisement industry. A 46-year-old due to weakness in their bodies, and they said that in alcohol industry would solve custom notifications to my friend and reminders to my friend when they were in a very vulnerable state. They don't say that the products are uh, toxic or that cause cancer. They say what is more convenient. The problem is not my perverse tactics of um, advertising. You are the problem that don't know how to control. The problem is you that doesn't know when to stop. The problem is you that drive under the influence of alcohol, and they don't mention that most of their profit comes from the consumption of young people. In the United States, it is known that 45% of consumption of alcohol by people under 18 in 2016 came from three alcohol companies. Sometimes there is information that there's a leak of information in this case. This case here, where they say that on the long term, they needed to attract younger people who will be the loyal consumers of tomorrow. So they are constantly saying that they are always thinking about the teenagers. But what they say to the governors, to the public administrators and prevention actions, they say, no, we want teenagers and children. We don't want them to use alcohol. So let's exercise sports without alcohol, but they will put the teenagers and the children and make them show their brand because they sponsor sports teams. I heard this from the adolescent in Colombia. It's all the time that they say that alcohol is for adults, that it's for older people, and I want to look older. So there is engagement here, but they are aware of the country effect, and they're not saying that industrial production of alcohol contributes to our planet's climate crisis and climate changes, because the use of water for alcohol production is huge, so that we hydrate ourselves adequately. In Mexico, the Mexican communities have expressed themselves regarding this industry so that they will stop manufacturing alcohol while they are short of water to drink. But what they are in fact saying is that no, we are very compromised. We are going to sponsor a carnival event in a sustainable way, committed, I'm sorry, because they're always interested in doing brainwashing and look like a company that is apparently committed to the planet. Of course, researchers and investigators doing all they can, they need to collect evidence of why we need public policies that protect. But these public policies are very difficult to be approved in Congress. Public policies like those in Colombia show how Bavaria, which is like Ambev in Brazil, Ha Bavaria is also in Colombia, and they are the sponsors of the Congress, of the members of the Congress, the representatives of the Congress. So they have a lot of power and a lot of money. And that is why we need, as a civil society, continue investigating and continue in the struggle. They say, don't work with us, be our allies. They don't say that they pay a lot of money for the policies not to be approved. In fact, they say it's good to partner with them. Let me conclude a resource we have at Movandi International that is only in English for now, but I hope it is useful. Here we have our site, View Alcohol Exposed, the five strategies that are the most common in the alcohol industry, similar to the tobacco industry. And we invite you to visit our website. Here we have Alcohol Industry Association, and you'll be able to see what are the large alcohol companies, where they are. There are several in Brazil, and also the fake companies by country. And Brazil is also part of this analysis, and examples, actual examples of interferences in different parts of the world. And I invite you to be part of this monitoring so that things actually change. We need to work prevention, treatment, and other areas. We are all citizens. We are all part of protecting teenagers, adolescents. So we need more people to learn about the predatory practices of the alcohol industry, and for that we need to share information. For example, I don't live here, but if you have evidence of an event or pictures of an event in this sense, we can make it visible so that such information circulates. We work with the civil society, we work with the Pan American Organization of Health, we work with UNICEF, journalists. We also let's add to the academia, let's add information, let's be careful, cautious when we talk about alcohol, because the way we talk about alcohol, the images that we use for preventive material is also very important. Let's do what the industry does, but with good intentions. Thank you so much. Thank you. I thank you for this such lively presentation, energetic presentation showing that society without alcohol is the task, a target that we all should engage in so that we can go through this path more strongly, having greater health benefits, well-being. Now we're going to listen to Laura Cudi, who's going to talk about recommendations for prevention and control policies regarding alcohol in Brazil. Good morning, good afternoon, I don't know anymore. It's a pleasure to be here. It's a challenge to speak after so many wonderful presentations, but also it's a good thing because part of what I'm going to cover has already been prepared for me. Many of the things I was going to talk about have already been talked about. So let's sum up, recapitulate, and show some of the policies we have in Brazil. Can you please put my presentation on the screen? So let's begin. Today, most of the information that are given to our children, our teenagers, does not come from school. Although the school is the place for sure to get this information for teenagers and adolescents. So for sure, also, it probably doesn't come from official sources such as the WHO, the Ministry of Health, OPAS. For sure, that's not where our youth access information. Where is it coming from? I would dare to say, and Angelica said so well, that most part of information comes from advertising, advertising from the alcohol industry that is everywhere. And as our Angelica mentioned, it normalizes the consumption of alcohol. So although we know a relevant portion of the population does not drink, the industry makes us think that it's completely normal to drink. Our work is to make it not normal anymore. So we do not need, it has to be do the effort that is contrary to the alcohol industry that associates alcohol with success, sports, culture, well-being, and even with health. So we need to do the opposite in our efforts, and we need public policies for that. So that's why I said, let's talk about Brazil and see what we can do here.
Well, it was also mentioned here, but let's recap. The alcohol industry say that drinking is great, it has benefits. What it does not say. It does not say that the alcohol is one of the main risk factors for for communicable and chronic diseases, cardiovascular diseases, cancer, diabetes, and so many others. It does not say that the alcohol is associated to over 3 million deaths every year in the world. And that in Brazil, according to Fiocruz, in 2019, there were over 100,000 deaths. It does not say that in Brazil we have a cost of 20 billion reais among direct and indirect costs. Think only about the public health system. So how it's costly to the public coffers. Now talking about the teenagers, which is the theme of our panel, 1 out of 5 from 14 to 17 years drank last year. 75% have never faced restrictions to buy drinking, but we have a law, right? In Brazil, selling to minors is forbidden. What does that show us? That one of the laws we have here, one of the policies that we have, is not working as it should. And there are others that are not even implemented, and we must work toward that. So, if teens are buying alcoholic beverages illegally, where are they buying? According to APEN's data, in parties, markets, bars, bakeries, convenience stores. That's a problem. And we also have the digital sale, delivery apps. I don't know if you have tried to purchase, but they don't need people to show their ID or prove their age when they going to sell. The question is, are you in the drinking age? The teenager will say yes, of course, in the app. So he can easily buy it, and easily he can get with friends or with family members at home. So what we can do beyond restriction, which is fundamental by the way. The World Health Organization has a package called SAFER, which is an acronym in English, which are the 5 main measures that we can implement to prevent the use of alcohol for the population in general. The first one is through taxes. We know that when it's heavy on the pocket, we consume less. Second, restrict advertising. Restricting availability, so we cannot purchase it anywhere and not at any time. Drinking and driving policies and brief interventions. I will focus on the 3 first one: restriction, availability, because they are the best buys according to WHO. Out of the 5 measures, these 3 are the most important one to decrease consumption and therefore save lives. First one, increase prices and taxes, the most cost-effective one. And to teenagers, this is especially important because they have a limited purchase power. If the alcoholic beverage is too cheap, and yes, here in Brazil it is, I should have brought some pictures. Teens have easier access. And we must also think about restricting open bar because if the price increases, you decrease the binge drinking. So increasing price is fundamental. Now we are amidst the tax reform in Brazil. Selective tax was approved for products that harm the environment and people. And we know that the production of alcoholic beverages also harms the environment. They have a water footprint that's huge. We are in the middle of COP30 here in Brazil in Belém, and we must talk about that a little bit. And that's good that the selective tax was approved for harmful products. Alcohol is part of these products. And we are working for the rate to be high enough for us to see results from the point of view of public health. Taxes must be self-sufficient to decrease consumption. And we are providing for a mixed tax regime. The higher the value, the higher the rate, and the higher the alcoholic content, the higher the tax. Of course, we need to have a lower limit because I think beer is responsible for 90% of the market and 70% of consumption. That's not, it's not attained. So we need to decrease consumption of beer. Tax must be updated according to inflation, adjusted according to inflation. And we'll talk about that later, but a recent Fiocruz study that was commissioned by the Secretariat of Promotion of Health and 2 civil society organizations, we worked together within the Resete o Álcool program, showed that if we increase by R$1 the can of beer, we can save over 10,000 lives every year here in Brazil. So we have a campaign on air. I don't know if you have seen it. It's in Brasilia and in other places in digital media, which is called the Reality Dose. I invite you to get to know our stands in the hallway because we always ask if people accept a dose of reality, which is the name of our campaign. And I invite you to get to know and support our campaign. And I brought a video. I hope it will play. Can someone help me to play a video?
Ah, é lá. Então, voltemos.
Oh, it's there. So let's go back. Anyhow, if you can play it, you can access on our website.
Ixi. Vamos seguir sem vídeo? Vamos.
Let's move on without the video. So another invite for you to enter the campaign's website. For you to know the population supports this type of measure oh, but then we say people no one wants to pay more taxes. But when people know it's a tax that can save lives, yes, they do support. 9 out of 10 Brazilians support an increase of tax for harmful products in Brazil. So second best buy. So the second one is restricting advertising. But Brazil already has a law for that controls advertising. Well, it's an old law from 1997. It's the same law that restricts advertising for fumigenics products. But due to a maneuver of the industry, it only considers alcoholic beverages the ones that above 13% of alcohol content, which excludes wine and beer, especially in the case of Brazil. So there is a beer ad everywhere. Not to mention digital marketing, which did not even exist in 96, and we must update that now. Young people are highly exposed to advertising because the brain is still under development. Children and young people are more susceptible to impulse, to have critical reasoning. So advertising is fundamental when we think about children, because advertising is an important strategy because they're capturing today the consumers of tomorrow. And this will be a habit that will be developed and remains throughout life. Therefore, it creates new consumers for its products. So we must review and update this 1996 law. We must include beer in that list and talk about digital marketing because we are nearly in 2026 and we can no longer talk about advertising without talking about the digital environment. We must forbid sponsorship of sports and cultural events. And only to add an information here, because among the bills that we see pending before the House of Representatives, we need warnings. They want warnings. Just like in the packs of cigarettes, you have, oh, the Ministry of Health warns you that. We must have one of those for alcoholic beverages, like some European countries are already doing. I talked about digital marketing. Most influencers are paid by the alcohol industry. So what's $5,000 million invested in alcohol advertising for influencers to say that the products are great, it's nice to drink, thank God it's Friday, and etc. And sometimes there are influencers who talk pro public health, which is the case of Carol Lobaki. Well,
turma saudável, sorridente, feliz nos comerciais de cerveja que assimilou a ideia de que para ser legal tem que beber. Mas não dá uma agonia imaginar que tem criança crescendo exposta a esse tipo de publicidade, igual a gente cresceu achando que era maneiro fumar? Ah, mas então por que não proíbem propaganda de cerveja igual proibiram a propaganda do cigarro? Porque a lei que regulamenta a publicidade de bebidas alcoólicas promulgada
enacted in 1996 is only valid for products with alcoholic content above 13%. And the beer is not in that list because most of them have an alcoholic content that's lower than that. But 30 years later, we already know that there's no safe level to consume alcohol. And beer is also alcohol, right? And in Brazil, alcohol is the main cause of deaths or problems from people to 15 to 49 years old. Isn't it about time to update that law and forbid or restrict the advertising of alcoholic beverages? I'll tell you something that's obvious, but it must be said. beer is alcohol as well. So if you think, do you think it makes sense that that beer, which also harms society and your health, advertises everywhere, TV, radio, social media, sports events? Tell me in the comments. A video by Carol Obaki. Share, spread the word. This is also part of our campaign. We try to work with influencers with no conflict of interests, and the population also supports such measures. 7 out of 10 Brazilians think that there should be restrictions to beer advertising. So let's move on. We also have a website that's on air with a campaign saying that beer is also alcohol. It's not a new slogan, it's not ours. We are reinforcing that. The third best buy is of restricting availability. We have a high density in terms of product sales. You can see, like in carnival, street carnival, you have people selling everywhere. 80% of minors buy in commercial establishments. So we need to have some sort of license, territorial control, some sort of time in which the sale is authorized. In Diadema in São Paulo is a city that restricted sale hours and has seen positive results. So why are not talking about that? Why can we still sell alcohol anywhere? Convenience stores. There's also a law in Brazil against drinking and driving. So you can't. And if you are caught drinking and driving, you'll be arrested. But you buy alcoholic beverage in convenience stores, in gas stations, which is at least weird. You can buy alcohol near schools. There are bills that intend to restrict distance near hospitals or health clinics. So there are many, many ways for us to restrict availability, which is extremely important because it also normalizes the use of alcohol. Other important measures, drinking and driving actions. Safer talks about brief interventions. We need early intervention training of healthcare professionals and teachers. Regular funding for research and independent actions with no conflict of interest. And funding and protection, just like in the previous lecture, since there is the Convention to Control Alcohol, there is Article 1.3 saying that the industry of tobacco cannot sit on the table of its self-regulation. So we need something like that for alcohol and other harmful products. And before talking about opportunity, we know what works. So we are not taking many of these measures or implementing them, not because we don't know that they work. It has been proven by many, many studies in the world that the safer package works, that the 3 best buys are cost effective. We are not implementing due to lack of political will and due to the lobby of the industry. So I believe that we must truly join forces. The huge opportunity now that we have is a tax reform. So for you who are experts and interested, please help us to increase the tax rate for alcoholic beverages.
There are 2 QR codes. This is my call to action. We're here in Brasilia at the headquarters of the federal government. Support a greater tariff for alcohol beverages. And you can also help us with a manifest to support the restriction of marketing for alcohol beverages so that we can change the law of 1996, which says that it can also include digital marketing in this alcohol law. For a better and healthier Brazil, protected against the damages of alcohol, not protecting corporate interests in this topic. Thank you. Thank you, Laura Cudi from CT Promotion to Health, which brought all of us, and I think we're here present or in the distance, reality check, because many of the actions he mentioned, Brazil had already at some specific times kept or carried out, such as restriction of alcohol in sports low places, but today it's becoming a backward movement in the sense. Beer is also alcohol, is something that we always have to mention. Encourage a project that began at the Public Prosecutor's Office of the State of São Paulo in 2014, a very strong action with several partners and support. Now it's expanded to Minas Gerais state. And we always have to think and contribute with that because it's the future of our cities, of our families. It's our future. So I'd like to also take this opportunity that we are here with 4 experts, professors, researchers, activists, promoters of health matters, prevention against alcohol and drugs, and ask all of you who could, if you could tell us a bit about a slogan here in our Congress, which says, alcohol is part of the conversations of my son. Alcohol is part of the conversations of my son. What should I do now? Professors? Experts, tell the families, the people present today that are parents, grandparents like myself, and also teachers that can be provoked by the teenagers about this matter. What can we think together to propose if someone asks you this question? Well, yes, there are techniques that are established of what say and how to say it to kids regarding alcohol. The first matter is making it very clear for your kids. I'm talking about teenagers, okay? That you as a parent do not authorize and that there will be consequences if the children consume alcohol. This needs to be said, well established as rules from your home rules, and that there will be consequences. Or for example, your kid drank at a party, so the first consequence is the next party you're not going to. So very clear techniques of what to do. That's the first affirmation. And the second one that is very important is the parents themselves knowing that their consumption influence their kids' consumptions. Many parents don't like us to say that, but literature is completely consolidated and clear in the sense that consumption from parents will influence the consumption of their kids. What we still don't know, I mean, there are studies that show that consumption of the parent influence the consumption of the father influences more the consumption of the mother, but there is an actual influence in anyhow. So first, say no effectively, clear consequences, and reducing consumption when with your kids. Something that I would add to Zilla's comments is that if this conversation is already emerging at home and the parents are part of the conversation, that's a positive point, because creating this environment that makes the kid feel comfortable to share with his parent and share his day-to-day, his activities with the parent, what their friends are up to, what he's up to, what he likes, what subjects interest him. That is also a protective measure. against consumption. So I would add this point. So if the parents are able to create environments that make the kid feel comfortable in sharing their day-to-day, their desires, their anxieties, their uh, their aims, who are they talking to, who they hang out with, that's already a protective parental style regarding avoiding alcohol consumption by their kids. I would also add the family or school environment is essential. I speak out of my own experience of having this type of dialogue, of care in my home, but I will also talk about the alcohol alcohol driven environment we have. So although you have a dialogue, regardless if you have a dialogue in the school, it's unfair the comparison, because when you go out to the street, to the world, there are $15 million invested for you to consume alcohol. So we need public policies that are effective, such as the ones I mentioned in my presentation, to corroborate this, so that it's not so natural, that it's not so that it's not that normal that they try to make it be. And we should do that with alcohol, just like we did with tobacco. Well, to start,
Qué bueno que estén conversando.
thank you, Juliana. And it's great that the adults talk to the kids, because we want the best for their kids. That's very important. So 100% support of everything that was mentioned just now by the three of you. But our children are not passive subjects, but they can also be activists. If you ask them, our kids are not okay with the perverse rule of alcohol. They're not okay with that. I heard that from a girl teenager in Colombia. She created a group leaders at her school to challenge the normalization of the rules of alcohol. And just by listening how uh, how unsatisfied they are with the industry alcohol. They not only support the arguments to be alcohol free, but also they try to take measures so that their younger brothers and sisters and other members of the family are not affected by the use of alcohol. Uh, Teenagers, young adults become active subjects and not only a passive subject. That really also helps change the situation. I really like to thank each one of our panelists for this lecture, for this deepened perspective, deepened technical perspective, and sensitive regarding alcohol and adolescents. Congratulate you, Juliana, Zila, Angelica, and Laura. Congratulations on your work, on making yourself available to be here at Freemind talking about this. You're not only professors, technicians, you're citizens. And as citizens, you bring a positive message to our society. And may adolescents and may young people, young adults and children are able to live without and have relationships without alcohol, to have happier futures like the ones we want for our kids. Thank you, each one of you, and thank you, Freemind, the 10th Freemind Congress. So if you could please, dear panelists, answer some of the questions that our audience has and would like to ask you. So if you could please answer them kindly. Thank you very much. Kindly answer them. Thank you very much. Let's take a picture of you. Is the photographer there? Yes, please help us. Guys, just to tell you that the next panel We'll talk about something very important, preventing suicide. And at the end of the last lecture will be spirituality and science together in the process of recovery, prevention, and treatment. Please come to these lectures and participate with us. Thank you.